is the idea of the superficial palpation? Why do we need it?
Localization of pain.
We need it to find pain localization. What else?
The presence of hernias, tumors.
Condition of the muscle. Normally muscles are soft, but also we can find rigidity or resistance. Hernias, tumors and abdominal muscle. So we can find what abdominal muscle. What else?
Resistance and rigidity.
That's only it.
It is condition of the muscles. What else?
Puffiness of skin.
Location of the pain.
So is the edema of the abdominal wall or not? Okay.
Location of the pain.
It was just one.
Puffiness of skin.
Edema of skin, puffiness, edema, swelling of the skin. So four main reasons to do it. When we do this method, first of all, we need to ask patient about presence of pain. If patient doesn't feel any pain, we need to choose this methodical palpation. We palpate patient's abdomen, starting from the left iliac region, go by down, next go from the upper regions to the lower one. If patient feel pain, we need to choose second method. We need to start palpation in maximal distance from pain location. If patient feel pain here, we will start palpation from this place. If pain is here, we will start from this place. And palpate symmetrical points. Painful point have to be last. Next, we have to do palpation from upper parts to lower parts, or opposite from the lower parts to the upper parts, depending on pain location. Why we need to do it in this way? Why painful area have to be the last?
To know if there are other pain, radiation of pain.
Not exactly.
Muscle contract like if
Spasm.
Muscle contract. So what will be if we will start palpation from the painful area? Patient will respond. Next we will palpate another place. But patient will
Say it's painful.
still feel pain because of pains will start irradiate to another area. So to find the exact localization of pain, we need to start it from the maximal distance from pain source. If we will start from the painful area, patient will feel pain everywhere, and we will not find exact localization, and diagnosis will not clear. Resistance and rigidity of muscles. Normally when we touch abdomen is soft. If we feel muscles contraction or abdomen is hard, it could be resistance or rigidity. How to differentiate? Is it resistance or rigidity? How to understand it? What is resistance? What is rigidity? What is worse, resistance or rigidity? Rigidity is worse. Rigidity is sign of peritonitis. Resistance is sign of local inflammation, local peritonitis or inflammation of the organ under your hands. But what are differences during palpation?
In rigidity, constant contractions of the muscles can be seen.
Okay, in resistance?
It's periodical.
What does it mean?
Maybe.
They will contract in time of palpation. We touch patient abdomen and feel like muscle contraction. It is resistance. Resistance and rigidity need to protect abdomen from pain. If patient feel pain, when we will touch it, muscles will contract to protect abdomen. It is resistance. If pain is everywhere, there is generalized infection in the abdominal cavity, there is peritonitis. Whole abdomen will be hard. Muscles will contract it always. we will not feel contractions of muscles, we will feel desk-like abdomen. It is rigidity and resistance. Hernias and tumors, abdominal muscles. So hernias can be present in the umbilical region, inguinal region, or in the areas of scares after surgery. Hernias are mostly soft elastics because of this intestine. Hernias, if they are not fixated, appears in the standing position and disappear in the horizontal position. In palpation, we can feel diastasis of muscles in area of hernia. There is area without muscles, which is portus of hernia. In abdominal masses, we can feel masses during palpation, mostly they are hard. Depending on depths of masses, they can be visible both in standing and horizontal position or only in the horizontal position. If abdominal masses, tumors are superficial, which is skin tumors or subcutaneous layer tumors, muscular tumors, we will feel it and we will able to see it both in standing and horizontal position. If it is tumor of deep structure, intestinal tumor, we will feel it only in horizontal position. If it's not very big. If it is big, we will find it in standing position. And edema of abdominal wall could be due to anastasia, in heart failure, for example, or it could be in renal failure, liver failure, due to generalized edema. What is the name of deep abdominal palpation? Deep abdominal palpation have many names. What are they?
Deep sliding.
Topographic.
Slide.
Sliding, topographic. What else?
Morphological.
Methodical. Palpation via Verstov method. Verstov is doctor who gave us this method. Deep palpation means we palpate deep structures. Topographical means we can find localization of organs. Sliding. When we do palpation, we use sliding movies to find organs. What else? Methodical. We do it according to exact method. There is order of palpation of organs. And the Verstov is doctor who gave us this method. Which organs could be palpated?
Sigmoid colon.
Intestines. Which intestines could be palpated? Only large intestine. One part of small intestines could be palpable. Which one? Sigma is not.
Iliac. Terminal end of
Whole iliac.
the terminal.
Only terminal part of the iliac. Intestines. Why? Why we can palpate colon and only terminal part of ileum?
Because it's close to the lumbar.
Small intestines could be close to the lumbar too.
It's behind.
Connected with
Why?
it is connected with colon.
Louder?
Inguinal.
It's connected with the colon.
Terminal part of ileum is connected with colon. That's why it could be palpable. But why colon could be palpable? Any one part of colon except rectum could be palpable. Rectum is deep enough, that's why we cannot palpate it.
Not deep.
Superficial. Maybe superficial.
No, we palpate deep parts.
Colon and small intestines are approximately in similar depth. Why small intestines cannot be palpable?
Small.
Because they are covered a lot of fascia.
They are covered.
Fascia,
Mesenteric.
peritoneum,
Mesenteric.
Colon could be covered too. Some parts of colon.
Due to the
For example, transversal colon. Peristalsis is same.
Fats.
My power is
This
on.
one to
Parts
No,
are
you don't.
same everywhere.
Because I limit.
The resistance is around this one. This is so it can be.
But
easily-
why?
The clear-
Colon is always around. Why colon could not be in another place?
That's the arrangement.
That's where God put it.
Why? Why colon located in exact places?
It's just kind of fixed.
Colon is fixated to this area. By which?
Ligaments.
Muscles.
Part
These
of,
ligaments.
it's not ligaments, it's
Medias.
mesenteric.
This is
Colon
medias.
is fixated to the back part of abdominal cavity with short mesentery. Small intestine has a long mesentery. That's why we cannot palpate it. Idea of deep palpation is to fix mesentery of organ, move organs so much how so it's possible, and next palpate it. When we do this movement, we put our hand over organ which we need to find. Next, we do the skin fold. Move our hand a little bit to the distance from organ. And skin fold is necessary to slide. Without skin fold, we will not able to slide. Next, we go into the dips and fix mesentery. Next, we slide, move part of colon and jump through this part. Colon have mesentery from 2 to maximum 10 centimeters. Small intestines, the mesentery from 20 centimeters to half meter. It is impossible to move our hands inside of patient's abdomen 20 centimeters or half of meter. And it is impossible to fixate this mesentery, even if we will push our hand very, very deep. When we will move it, small intestines will move together with our hands, we will not fix it. That's why it is impossible.